we were together at the groundbreaking back in June 2015, I'm amazed at how fast this building has come together with such high quality services. And I remember touring and meeting some of the people here, staff and the people that we serve, and seeing how people were so happy being together and excited about this new development, and how they were recovering and healing in such high quality facility. And also they were enjoying some dirt cupcakes. So I don't know what we have today, but I'm sure it will be fantastic. I'd like to extend a special welcome to State Senator Tanya Shoemaker, to Jan Heerstring, representing our Continuing Care Patient and Family Advisory Council, and to Todd Abbott, a former patient, and his wife Kim and his family, who will share a remarkable story about recovery. Thank you so much for coming. As you will hear, our programs make a difference for the people that we serve. This facility is so important for our community, for Spectrum Health, and for those that we serve. And we are pleased to provide enhanced environments to support compassionate care and healing right here in West Michigan. Spectrum Health is one of the few health systems that can provide a full continuum of services with high quality and high satisfaction, and that has an emphasis on brain injury. This place is special. We are unique. We've been here for more than 30 years and have provided inpatient rehabilitation with an emphasis on neuro-related rehab. Many staff here are recognized for their expertise in neurorehabilitation, and this program is part of the Brain Injury Association's Alliance program, which specializes in staff education for neuroservices. And so I am extremely proud of our team here, caring for the people that we so much need to care for them here in West Michigan. They are providing high quality, high satisfaction services and much needed services here. I'd like to recognize our leadership for their insight and support in developing this building and identifying this as such a need. Rick Breon, our President and CEO, Chad Tuttle, the President for Spectrum Health Continuing Care, Mark Sherkoff, our Senior VP for Regional Relationships, and some of my colleagues, Ron Knaus, Patrick O'Hare, and David Leonard, for your support in this. I also want to recognize our boards. Our boards gave us the support and approval for this work, and that was so important for us to continue this and to show that we are here for our community. And then two leaders, two amazing leaders at this campus, Connie Mahan, our administrator, and Cindy Barris. You are the heart here, and we so appreciate everything that you do. This is a beautiful facility, so I want to recognize our craftsmen and women who built this facility, including MKM Architects, Craftsman Company and their design build partners, and our Spectrum Health Facilities team led by Rick Rudetsky. They also were fantastic because we appreciate how they met the green guidelines for healthcare construction, which is a standard that we try to achieve everywhere. I have special thanks to our Continuing Care Patient Family Advisory Council. As council members, you gave us lots of advice about the facility and about the amenities. And as family members, we so value your input, and thank you for everything you do. And to the people that are here every day, our providers and our staff, you challenge us to improve what we do every day, to provide that care with high quality and high satisfaction in a safe way. I appreciate your commitment and your hard work because it's so invaluable to make that transition from the old facility to the new, and for the care that continues throughout this process. And I want to thank the volunteers that come every day to serve the people that we care for here. I'm sure you noticed the Grand Rapids Symphony Orchestra Ensemble here earlier, and it was wonderful music. We collaborate with the Symphony at our Center for Music for Health initiative, and so we're very appreciative that they were here today to share in this celebration. And last but not least, I'd like to thank all of our donors. We couldn't do this without our donors, and so we're appreciative of everywhere that you've contributed, including the healing garden that donors contributed to but also helped us create. And then all of those mentioned and many, many more are working together to ensure we continue to achieve our mission and our vision. And I'm so proud of the work that you've done here as we transition from the old facility to the new facility. And there will be many more new things going on here, but also the most important is that we can care for the people, help them heal in West Michigan. And so now I'd like to introduce Mark Shurkoff to talk about the community impact.
Thank you, Tina. I'm Mark Shurkoff, Senior Vice President of Regional Relationships. What a great day. That's all I can say. I mean, really. Hope you realize this is about a 5-year journey for us to build this facility. And the efforts that the staff and the teams that worked on this have culminated in this day. We're able to do this because of the care that has been provided here. And Tina mentioned the heart of our organization. That's what makes this facility different. This is a significant commitment on behalf of Spectrum Health. It's a $25 million investment. And improvements are for the patients that we serve and our community. There's also a local economic impact to our investment in the community. This facility has been here since the mid-60s, so it's been part of the community, providing care for our patients throughout West Michigan. But I hope you also realize that patients come well beyond West Michigan for their care here. Traverse City, Saginaw, Detroit, Kalamazoo, Flint, and even out of state, people receive their care here because it's recognized for the services that are provided. Today we're celebrating a wonderful addition to this facility. 2 stories, 122,000 square feet that provide state-of-the-art facilities for our patients, and 165 patients can be cared for in this facility. We recognize the impact that this has had on our neighbors. We try to be good stewards, but anytime you do a project of this magnitude, it creates disruption in the community, and we thank them for their tolerance. As we move into this new facility on August the 16th, a portion of the old facility in the back will be torn down and allow for more parking and more convenient access for our patients. We look forward to the future in this facility and the patients that we serve on this campus. I want to thank everyone who's played a role in making this all happen today. I have to thank a good friend. Thank you, Ron. Ron's leadership and commitment and encouragement to this. This was a difficult challenge, and I thank you for that. Chad, I'm going to turn it over to you and welcome you to the stage. Thank you.
Thank you, Mark. I'm Chad Tuttle, President of Spectrum Health Continuing Care, and I get the privilege to talk a little bit about what's going to go on inside this building. As Mark shared, it's 122,000 square feet of space for 165 patients. That's almost twice as much space as we've had for our 165 patients historically, and we're just excited about that. The services we really put into 2 categories: short-term rehabilitation and long-term care. And I want to talk about the short-term rehabilitation because what goes on in these walls is really special. There's over 15,000 facilities like this in the country, but there are only 5 in the entire country that have been accredited by the Commission for the Accreditation of Rehabilitation Facilities, which is a long name, so we shorten it to CARF. CARF accreditation for medical rehabilitation for brain injuries and strokes. This is one of 5 facilities in the country with that certification. And while the environment is a strong component of that, and we have now the newest, best environment for that, it really comes from the staff and the great care and the certifications and the skill set that the staff bring to their roles and expertise. And we're just thrilled for all the care that we will be able to provide in this building. For brain injuries, for strokes, for joint replacements, and other orthopedic and general medical rehabilitation needs. We also provide long-term care. And the long-term care is for our residents who will stay with us for a very long time. The long-term care will primarily be provided on the second floor of this building. We have 77 beds on the first floor, almost entirely private rooms for our short-term rehabilitation. And then on the second floor, we have 88 beds, with the vast majority of those in enhanced semi-private suites. Really just remarkable space that we have. And Tuesday night, we had the opportunity to bring some of our residents over and introduce them to the space. And they're just really excited for the opportunity to move in and the great care that they're going to be able to receive in this building. One of the things we'll be moving into this building as well is our art and music therapy programs. Tina referenced earlier, we have a tremendous partnership with Grand Rapids Symphony to provide sensory and therapeutic experiences via music for our patients. Our new facility was really designed with the opportunity to keep safety first and foremost at the front of the care and provide an environment of healing while also providing an incredibly safe environment. So as I mentioned, private rooms, enhanced semi-private suites. As you get in there later, you'll have a chance between the floors to see that each floor and each wing is really divided into households. Each household is designed with its own staffing and nursing station. It's designed with its own dining space and activity space for residents to enjoy. We also have a very large rehabilitation gym, which will be, it's not full of equipment today. We'll be moving that in this weekend, but you'll have a chance to see that many hundreds of people every year will have the chance to experience healing in that rehabilitation space. We also have a low stimulation rehabilitation gym for those who have neurological conditions and require a quieter, softer environment for the rehabilitation needs, and you'll have a chance to see that. Enclosed courtyards, rooftop gardens, all really designed with safety in mind so folks can have the best of experience while having the safest of experience in their care as well. We're really excited for the team. We're excited for all of you to join us today, to have a chance to see this healing environment and to hear firsthand about the care that gets provided in an environment like this. I'm going to invite Todd and Kim Abbott to come up and share their story. Todd had a chance to experience care at our existing facility in the past, and we're going to invite him up to share about that story and that journey.
Great.
We are just honored and touched to be part of this, and that you invited us here, so thank you for that. Like I said, I'm Kim. This is my husband Todd. My mom Barb is here. One of our sons, Danny, is also with us. So we contemplated a lot and talked amongst us. What do we want to say today? What do we want to share about our story? So I guess we want to just tell you a little bit about who we are, what our story is all about, and what in the heck brought us over to Grand Rapids, because we are not, from this area, and what this place means to us. So I guess I'll start with our story. Really, it was about 4 years ago, and we were here in your older facility, about halfway through our care. We started out the journey thinking we were going to be here maybe 30 to 45 days, and that turned into about an 8-month stay. So quickly, this place became our family, and welcomed us. So a little bit about our story. It was December 4th, 2011. My husband, who was a very healthy, active guy, he was 51 years old at the time, woke me up in the middle of the night, had a terrible headache, said he felt like his head was going to explode, that we really needed to get to the hospital. I'm like, woke up like, what? What are you talking about? I mean, he's a healthy guy. He never had any issues. You hear these stories happen to other people. You never think it's going to happen to you. But, within that, kind of that scream for help at, I think it was 3 o'clock in the morning, within about 15 minutes, he had collapsed to the floor. We had called 911, and, our journey, I guess, began at that point. So he was taken into the hospital, had a brain aneurysm, that hemorrhage, it was a subarachnoid hemorrhage, grade 5, and for those of you that know anything about that, of course, that's the first or the worst grade level that you can have when something like that happens to you. So the prognosis was not good. They prepared us for the worst. It was pretty doom and gloom. But again, we kept going back to he's a healthy guy, right? He's 51 years old, and fortunately we were given the right care right away, and they saw something within Todd and decided, right, let's do what we can to save this guy. And it was a long journey. I think it's hard to say when he came out of a coma, but it was probably a good 40 days. So I know he still doesn't like to hear this. It's like we're talking about somebody else, not ourselves.
Yeah.
We were in the Beaumont Medical Facility down where we live, which is the east side of the state in the Detroit area, for about I think 6 weeks, maybe longer. And then from there we went over to what they call select specialty. Just really buying ourselves some time. It was all about medical stability at that point, but we knew he couldn't come home. And so then we were challenged with, where do we go? What are we going to do? And it was pretty scary. The case managers that we worked with, the facilities that they were having us go visit in the Detroit area, were, it still gives me nightmares today. We visited quite a few, and it's just a typical nursing home. There was just no way that Todd was going to get the care he needed to be able to get his life back. And so thankfully we had a lot of friends and a lot of family support, kind of digging through stuff and trying to do that search and figure out where to go. And I think I happened to see a brochure, and we knew enough about Mary Freebed, and we knew enough about the Rehabilitation Institute of Michigan to think maybe that's where he needs to be. But at that time we were pretty naive in terms of what he really needed, and saw some marketing material that said this Spectrum Neuro Rehab Facility, it's a feeder program for Mary Freebed. And the light bulb kind of went off, and it's like, hey, maybe that's what we need. The drastic measures. I know Grand Rapids isn't around the corner, but let's go check it out. So kind of, that's kind of where our journey started here with Spectrum. We came and we took a tour, and luckily we met a lady named Cindy Barris at the door. And I tell her today, I think if it weren't for her, I don't know that we would have come. She was, you guys hit it when you said this place is special, and it really is. She greeted us at the door. She made us, she was passionate. She wanted to hear our story. She told us what the facility could do for us. She gave us a tour, and at that moment when we left here, I was with my brother. I finally had that, more of that relief and that comforting feeling, like, we can do this. This is the place for him. So it was quite a fight getting him here, but we were able to manage it, and we arrived. So when Todd arrived, he was on a stretcher. He couldn't really move. He had a trach. He had a feeding tube. He had a catheter. But the day we started, and that that therapy team that was assigned to Todd saw something in him, and that's what we always say. It is all about the people. It's one thing to have the education and the experience, but if you don't have the passion and the motivation and the desire to help somebody, that it's not going to work. And boy, immediately the team just believed in Todd, sometimes I think more than we did, right? They were so determined to give him the best recovery possible. And so we were here for a long time, 8 months. But when we left here, Todd walked out the door. He needed more help than he needs today with the walker, but he walked, he talked, he could eat. He didn't have his feeding tube anymore, his catheter, his trach. And we were finally ready to go back home to the east side of the state. So that's kind of our story. And I said, in terms of, a lot of times we tell people the story today, and they're like, Grand Rapids, why would you go to Grand Rapids? We're from Romeo, which is a small town. It's about 2.5 hours from here. And we always talk about the people, the care that he got here, and we truly believe we would not be our life would be completely different had we chosen one of those, nursing homes back on the east side of the state. But now we're pretty excited because now we can say it's not only the people, but this facility is, amazing. We're pretty excited to get the tour and see what it's all about. I think that one of the things that we're very excited about, when we were here, we fought a little with the help of Cindy and Connie, of course, and we're able to get Todd a private room. And I tell you, the difference that made in his recovery was huge. So to think patients that are coming here now and they're not going to have to fight for that, and that's just part of the care is pretty incredible. I think this looks like a very impressive place. Todd, did you want to say a few things?
Yeah, time?
Yeah, you.
Yeah.
Sorry.
No, life is great. Dogs, Jeremy.
Todd's very shy, doesn't have a sense of humor at all.
Yeah, very shy. All right. Just turn left and we doing to do this. Yeah. Yeah. All right. On behalf of my wife and my son and my mother-in-law and my other son who's not here, Rand, thank you from all my heart. Thank you. All right. Now, I feel when you cry. It's not bad. I left like 5 to 2 seconds. All I can say is about Spectrum is that I was willing here, and I was accepted with open arms and hard work, and thank you again. But just remember that Spectrum is making a difference in people's lives always, okay? It may not seem like it, day 1, day 2, day 3, day 4, but after day 80, grade 5, or 10 or 5, whatever, it makes a difference. I was very, very lucky to be surrounded by a great staff, Spectrum staff, a great family, and even better, awesome, incredible wife and son, 2 sons. Okay? So we stumbled across Spectrum, and we were very, very lucky. But just remember that all the people that come here, they remember to try to give them the best you can, even if you don't want to. Sorry if I stumbled on words here, but even though you don't want to, right? So dig down and love them, support them, and do what you gotta do. Thank you very much. That was great.
Well, Todd and Kim, I want to thank you for sharing your story. And I know it's not just sharing your story today, but you have worked with this team. You have worked with additional patients and families who have been here to provide them with hope and to help them know that their journey can move forward and that they can have that hope and know that there are better days ahead. And we thank you for all the work that you've done with them.
Of course.
I'm going to ask you if you want to join me over at the ribbon. We're going to do the ribbon cutting now, and I'm going to have Kim and Todd join us, and Mark and Tina as well, who you heard from earlier. I'm going to ask Jan Kiersmink to join us as well on behalf of our Patient and Family Advisory Council, the group who really helped us contribute to the design and provided just vital input to what the facility will look like. And then Connie Mahan is our administrator of the campus here, and for many years, Connie's leadership and Connie's vision and Connie's input and literally hundreds and hundreds of hours into tens of thousands of decisions has contributed to what we have today. So I'm going to have you join me at the ribbon. Following the ribbon cutting, I'm going to invite all of you to join us inside. We have the air conditioning on, so that's a good thing. We have plenty of food. We also have some self-guided tours, and we have folks with red post ribbon badges who will be happy to guide you around. The building is done, however, we have placed ribbons in various places. We've been busy cleaning the building and getting the building ready for residents to move in on Tuesday, and so we would ask that when you see ribbons like this in the building, first, please don't cut it. And second, please don't cross it. But please do enjoy the building. You will be able to see every part of the building that is complete, so you can see a full picture of the care that will be delivered in this building. But thank you all for joining us. We'll cut the ribbon and invite you to join us inside.
Thank you.